Welcome to the MediByte channel. I'm your host, and today we're jumping right into a really crucial, deeply reassuring MediByte explainer on vaginal bleeding during pregnancy. We're going to focus heavily on the early weeks, but we'll absolutely cover those critical shifts that happen later on too. Now look, I know this topic can spark a lot of fear, totally understandable, but by the end of this explainer, you're going to have the exact, fact-checked medical knowledge you need to strongly advocate for yourself or the people you love. So let's get into it. Okay, let's just ease some of that anxiety right off the bat. Get this, 20 to 30% of women experience bleeding in the first 20 weeks of pregnancy. I mean, that's literally nearly 1 in 3 pregnancies. So, while it's definitely scary in the moment, it's absolutely vital to remember that a huge number of these women go on to have perfectly normal, healthy deliveries. Basically, bleeding doesn't automatically mean the pregnancy is lost. It just means, hey, we need to pay much closer attention. Here is our clinical roadmap for this explainer. 1. The reality of bleeding. 2. Early pregnancy causes. 3. The ectopic risk. 4. Late pregnancy complications. And 5. Clinical action plan. Section 1. The reality of bleeding. Understanding the first 20 weeks. So bleeding can range anywhere from just tiny little spots on your underwear to, well, very heavy blood loss. Now, light spotting, that can sometimes be totally harmless, just part of a normal pregnancy. But passing large amounts of blood is always a serious concern. If you ever experience heavy bleeding, you need to reach out to your doctor immediately because it can actually lead to dangerously low blood pressure or even shock. Honestly, the golden rule here is simple. If you're pregnant and you bleed, just contact your healthcare provider. Better safe than sorry, right? Section 2. Early pregnancy causes. Miscarriage versus normalcy. Let's talk about the most common reason for early bleeding. In about half of the women who experience it, the cause is a miscarriage, which is medically known as a spontaneous abortion. When this happens, it usually plays out in a few distinct stages. First, you'll see the bleeding. Then cramping kicks in, and that can be pretty severe, honestly, while the bleeding usually gets heavier. Finally, the pregnancy tissue itself may pass. If you suspect you might be going through this, you've got to call your doctor. Sometimes medical treatment is necessary just to make sure everything passes completely and safely. Now, what actually increases the risk of a miscarriage? Things like being over 35, having previous miscarriages, smoking cigarettes, using illicit drugs like cocaine, or having structural uterine issues like fibroids or scarring. But here's a really fascinating and frankly empowering fact. You know how doctors used to always prescribe strict bed rest if a miscarriage was threatened? Well, there's actually zero scientific evidence that bed rest prevents it. So if it happens, please do not blame yourself because you weren't lying in bed all day. Science tells us it literally wouldn't have changed the outcome. Section 3. The ectopic risk. Identifying medical emergencies. Okay, we need to contrast that very common risk with our most dangerous one. Miscarriages are common and they happen inside the uterus. But an ectopic pregnancy, that's an abnormally located pregnancy, usually stuck right in one of the fallopian tubes. This is a massive life-threatening emergency. Because the tube is so small as the embryo grows, it can actually cause the tube to burst. We're talking severe sudden pain and heavy internal bleeding. If it's an ectopic pregnancy, the pregnancy unfortunately cannot continue, and it has to be treated immediately with medication or surgery just to save the mother's life. Section 4. Late pregnancy complications. Shifting risks after 20 weeks. So what's super interesting is how the risks completely shift once you hit that 20-week mark. Bleeding suddenly becomes way rarer, affecting only about 3 to 4% of women. And get this, the most common cause of late-stage bleeding is actually totally normal and a really good sign. It's called the bloody show, which is just a small bit of blood mixed with mucus. It simply signals that the cervix is opening up and labor is on the way. That said, late bleeding can sometimes point to really serious complications, so we've got to be aware. The most common life-threatening cause here is placental abruption. This is when the placenta prematurely peels away from the wall of the uterus before delivery. Why is that so dangerous? Because it can trap blood inside where you can't even see it, completely cutting off the fetus's blood supply. It can happen spontaneously, often tied to high blood pressure, or it can happen after a sudden physical trauma, like a car crash. Another major one is placenta previa. This is where the placenta attaches incredibly low down in the uterus, and it actually blocks the cervix, the exit doorway for the baby. This usually causes sudden, but completely painless, bleeding. And listen up, because this is where you really need to be a fierce advocate for yourself. If an ultrasound shows you have placenta previa, you should feel 100% empowered to remind your doctors of this and explicitly refuse any standard digital cervical exams. A gloved hand examining the cervix can accidentally trigger massive, catastrophic bleeding in these cases. Section 5. Clinical Action Plan. Warning signs and next steps. All right, here are the absolute red flag warning signs you need to memorize. Fainting, feeling super lightheaded or having a rapid heart rate, that could mean dangerously low blood pressure or shock. Severe abdominal pain that gets noticeably worse when you move around, that strongly points to a ruptured ectopic pregnancy. And if you have a fever combined with pus in your vaginal discharge, you're likely looking at a severe infection. If you have any of these warning signs alongside bleeding, do not wait. You must seek emergency medical care immediately. When you get to the ER or the clinic, your healthcare team is going to follow a really precise set of steps to figure out what's going on. First, they'll check your vital signs to make sure you're completely stable. Next, they'll do a careful pelvic exam. After that, they rely heavily on a transvaginal ultrasound. This tool is pretty amazing, honestly. It can pick up a reassuring little fetal heartbeat as early as 6 weeks in. And finally, they'll order blood tests to check your HCG pregnancy hormone levels and, crucially, to check your blood type. Speaking of blood type, checking your Rh status is an absolutely vital step. If you have Rh negative blood and you experience any vaginal bleeding whatsoever, you absolutely must receive a specific medication called Rho-D immune globulin. Why? Because it physically stops your own immune system from making antibodies that would attack the baby's red blood cells, either in this pregnancy or in your future ones. It's just a simple shot, but it is deeply protective for your long-term family planning. So, knowing the critical differences between normal early spotting and a true obstetric emergency, how prepared are you to advocate for your maternal health? Look, maternal health care works best when you're an active participant. Knowing the difference between the bloody show and placenta previa, or realizing that severe pain means ruling out an ectopic pregnancy, that knowledge gives you a profound voice in the exam room. Knowledge literally is your best tool. Thank you so much for joining me on the MediByte channel today to navigate this complex topic. Our whole goal here is to make sure you never have to face a medical situation feeling like you are in the dark. So please like, share, and subscribe to our channel right now so we can keep bringing you clear, details, and empowering medical knowledge. Stay informed, stay healthy, and we'll see you in the next explainer.